On March 11, 2020, the World Health Organization declared COVID-19 a pandemic. In the weeks and months to come, our lives were turned upside down.
We're seeing pictures, we're hearing stories of, they're setting up tents outside with ventilators and how we get our hands on this stuff.
It just seemed like society was completely disrupted. Everyone's routines were disrupted at work, home, everything. We're in historical times here. Every email had unprecedented times. You heard that. It was just every email had that.
It didn't seem real at first, certainly, but then it became real quite quickly, and we just, had to get up to speed in a hurry.
We really started in the process early on, which now when I look back at that, I'm very proud of our facility and in our town in general for the work that we put in, thinking this was going to hit us at some point in time.
In March 2020, when I was at my previous hospital, I was tasked with developing the preoperative testing for COVID. So right when testing was coming out, I had to develop a strategy to get the patients in to the hospital to get them tested safely, and then also to develop our protocols to get the patients into the operating room safely that needed to. So that was at my previous hospital, and then so that was in March, and I moved here in August, and then when I got here, it was super smooth, that process. It was all done already, and we were just talking about Jen Kratz, who is the operating room head nurse, and she had the process down along with all the other nurses in the clinic, and I just thought that was super impressive because I had spent all this time developing that right away at the previous hospital. It was a bigger hospital than Sanford Vermillion, but what that means is that there's really less resources here because sometimes than other bigger hospitals, and to have it done so smoothly, I was super impressed and very thankful.
Many things were unclear in the beginning, but one thing that was clear, information was going to change.
It changed every single day, almost every hour, about what we were doing.
Whether it was protocols, whether it was testing, whether it was, somebody's sister is positive, so now they're quarantined, so they won't be in today. Somebody's daycare provider had a positive, so they don't have daycare, so they won't be in today. So it was honestly an ever-changing daily thing.
The week, we had our daily meetings and the information was changing so rapidly. It's that you had that sense of anticipation. You knew it was coming. It was like waiting for the other shoe to drop. When are we going to get our first case? When are we going to get our first patient?
I can remember the first patient we had that we knew was COVID positive came into the ER, was a walk-in, and of course we closed all the doors, and it was very much to the magnitude, if you would.
It was just the high stress, high anxiety of, having to now perform all these duties in the PPE, having to make sure you're taking stuff off, putting it on in the correct order. And so, the nursing side of things, we buddied up for a while, coached each other through how to do things, just kind of used a team approach on these first few COVID patients until people, really got comfortable with what they were doing.
With so many things changing, some creative solutions were used to help residents transition to the new normal.
It was critical at the beginning. I took photographs of staff and put it on brightly colored paper, and they were giant because the residents didn't understand at the beginning of why is everybody masked and who are you? And so that turned out to be, kind of a funny way to reconnect.
For a long time, no family could visit Dakota Gardens. Understanding the need for a connection, a clear plastic barrier was installed to allow families to see the residents again. This was a project that had an immediate impact on everyone.
Some of the family hasn't seen their mother or father for a while, or daughter, or whatever you want to say. I mean, they got me here that they got to see their family.
Giving them that extra sense of relief was really nice to see.
You could see the residents' excitement and the family's excitement at least being able to see them, but there was still that need for physical touch, which took a while to come.
Having the ability to test community members for COVID-19 was a critical task to help keep the community safe and to better understand the virus.
We'd done drive-through flu shot clinics before, so the drive-through thing wasn't really any kind of a different idea for us, but we were going to be testing, so it was a little scary. When we did USD testing before Thanksgiving, because they were supposed to kind of get tested before they went home, and we had them all the way up to Main Street, because people would say, do you realize you have traffic backed up to Main Street? And we're like, so her and I are in a PAPR for almost 2 hours in the tent. And, you know,
got warm.
It got warm. There was plenty of sweaty days.
Yep.
And you were literally dripping with sweat underneath that PAPR. And you would see if your air button was on, actually. Yeah.
Summer turned to fall, and word of an approved vaccine came to Vermilion. Eventually, a vaccine was approved for frontline workers, and it couldn't have come soon enough.
2 days before Christmas, we were able to vaccinate our healthcare workers. And it was on a snowstorm, and people came out. People were there ready for us. We didn't have our processes like totally in place because we kind of got sprung on it like a few days before, but we were able to figure it out, and it was pretty cool.
I feel like everyone that got their vaccine just went, like took a really big deep breath, and it was like everyone was so happy. I've never seen, like, I came here like 2 months before COVID happened, and so then the dynamic of people is like very interesting to like hop right into a pandemic. Like I didn't know people here very well, and it's like you only know their game face, like they're ready to go, and everybody seemed a lot more relaxed, and it was a lot more, I don't know, everyone was like laughing and having fun, and kind of just sense of relief. Right before Christmas is an awesome Christmas present.
Once essential workers were vaccinated, it was time to start vaccinating the rest of the population. However, between answering the phones, calling people to let them know they could get their shot, and all of the rest of the logistics, this was no small task.
Definitely a challenge for all of our staff. I think it, tested us. I mean, it put us in a role that we weren't used to. You're used to a busy day, but nothing compared to what we just encountered. Those phone calls, you come home at night, you're like, I can't talk to another person right now. I'm so tired. But yeah, it was a challenge.
Our biggest vaccine day was like 650, and that was a lot that day, but we've become a very fine-tuned machine. Yes. And on Tuesday we did over 500, and we were done within 4 or 5 hours, so we've gotten very good at drawing vaccines.
I know one of our patient access staff, I think it was the first day we did it, she's like, have you ever seen an 85-year-old lady run with her walker? Or a gentleman so excited to take his wife to get a perm. It was like social hour. I called it Ladies' Aid. People were so excited to gather. They didn't care about social distancing at that point. I could have our chairs separated out as much as possible, and they were moving. One of the gentlemen that we had, his wife was sitting down, and he was coming behind him. He was walking down that hallway, and she says, oh, come sit here, honey. And she looks at him, I'm going to go see my friend. And he goes down to the other end and sat with his best friend, and they talked for 15, 20 minutes. It was so exciting for them to get out and see their friends.
It's been gratifying, honestly. Those patients that were waiting for so long to go see their grandkids or, anything in general. I mean, they were so gracious to us when we finally called them and were able to give them that shot, finally.
Everyone's hard work, at all levels, did not go unnoticed.
I guess I thought I was safe here. And I listened to the news, but I never felt like, I was in trouble of any kind, or that, gee, the world was coming to an end or something. So I felt safe here. Just that they were taking good care of me, and they were doing what they were supposed to, like I say, with Mass. Ever since I've lived here, I've liked it, and I've been taken good care of, and I don't feel any. I'm not fearful.
All of the departments did a great job, I think, adapting. I think our nutrition services did a great job with, like I said, some days we didn't know coming in how we were going to serve. Not necessarily, boxes, no boxes, are we going to be in person, are we not? And just the adaptability of, I think, really every employee here was pretty impressive.
I really have to commend my whole clinic staff and everybody that I worked with, because they pulled hard. They really did what they needed to do. It was a scary time. People didn't know what was going to happen. And, it was like, are they now putting their families in danger because they're coming to the clinic? But on the other hand, everything was cleaned so well and sterilized and, kept up that, we weren't taking it home to our families. We didn't catch it there. So that was a very good thing. And everybody was so good.
We have a good team, and I'm very happy about that. I'm proud of the team of IDT managers that we have, and also my staff. My staff did just a wonderful job.
Our community really stepped up and provided volunteers when we asked, whether it be retired nurses or even active nurses who aren't practicing right now, but to be able to push through 700 vaccines in a day, we really needed those volunteers, and they were just amazing in greeting it. And it was emotional for them too, to come through. Once they were, once they felt safe, once they were vaccinated, they were taking care of their community, and that meant a lot for them.
Attitudes always remained very high. Now we tend to laugh at each other a lot of times, which is good. But I don't think, in my mind or in what I saw, that it ever really put a big damper or a big hit on our culture here. I think everybody really kept the same consistent positive attitude, and I think that's kind of a reflection on how our outcomes eventually turned out. I think for the community here that we had a very good outcome out of a bad situation.